All right, perfect. So Shalene, please feel free to introduce yourself. Again, this is our family workshop for this month on what to expect from your medical provider.
So good afternoon, everybody. My name is Shalene Chin Green. I'm a community health worker and a mental wellness worker, and I'm based at the Mount Vernon Health Centre, formerly the Mount Vernon Health Centre, now Westchester Community Health Centre. And we're located at 107 West 4th Street, Mount Vernon, New York, opposite the Greater Centennial Church and across from the Dole Center. And I'm just going to spend a couple of minutes just telling you about some of the services that the health center offers for you and your families, and then we'll go into the main discussion, okay? So the health center, as I said, we call it a one-stop shop. We have everything under one roof. We have pediatricians, we have a behavioral therapist department, we have a dental department. We have an internal medicine department, we have a walk-in department, we have a patient registration department. We can help you with everything from insurance to WIC. Really, we're here to help everybody from the cradle to the grave. We also are able to help individuals who do not have health insurance. We will be able to sign you up if you meet the criteria to receive services at the health center at a minimal cost. I have left my name and my contact number and email in the message box, so you can access that at any time during this talk. And Gloria will also be able to forward you my information, and I'll be happy to help each and every one of you. Okay, so we're just going to get into the main discussion, really. I was asked to speak about what you should be looking for when choosing a pediatrician, but some of the things I'm going to share with you, you can always use them with yourself too. So really and truly, just to be practical, you always need to choose a provider that's easy for you to get.
Yeah, it's going to rain until tomorrow too.
Hello? Can you put yourself on mute, please? Thank you. You should always try to choose a provider that's close to your home, somewhere that you can get to easily, somewhere that's accessible, somewhere that you can take your stroller, or, you know, you can have easy parking to, because if you're trying to get to places that are not easy to get to, you're stressed by the time you get there, your child's stressed. So always look at those practical aspects first. I always say the best recommendation when looking for a pediatrician is word of mouth, okay? There's nothing better than somebody else's referral. So always, you know, reach out to friends, ask questions, people within your community, they will always guide you in the right direction. If you don't have any friends or you're new to the community, you can actually look online, and you can actually review practitioners. They usually have a star rating, and a website like Yelp, you'll be able to see, you know, what other people think about the services that they're providing. So that's also another good reference. And of course, myself, you can call me if you know anybody that might need help in finding a provider for themselves or their child. Some of the more practical things. So some people actually, when they're choosing a pediatrician, even before they get pregnant, they will go to several providers. They'll interview them, talk to them, and make sure they feel comfortable with them. And that, I think, is always a very good idea, because this is a person that you're entrusting your child's health in. You should feel very comfortable to talk to them. You should feel that they're listening to you and they're not busy just, you know, writing a prescription. And you have to feel comfortable with them. It's like any relationship. It's like, you know, finding the right school for yourself, or even looking for a partner. You have to find somebody that you communicate well with and you trust. All right. So these are some of the things that you have to consider. If you go to an appointment and you have a provider that you feel that is not providing, you know, making you feel comfortable or making you feel more more, comfortable in not treating your child the way that you would like to be treated, that's not going to be a good long-term fit for you. So those are some of the things that you should actually think about. Making appointments. Some doctors' offices actually have tours. They'll have tour dates where you can go in and you can speak to whoever works there. So those are the front desk staff, the staff that work behind the scenes. Another thing I would recommend when looking for a provider is that try not to find a pediatrician that works by him or herself, because that's going to be restrictive for you, because they're only going to be able to see you when they're open. If you go to a bigger practice where there's maybe 2 or 3 pediatricians, they're more likely to be open longer hours. And that means that you'll get better access when you need. So some places have Saturday hours, some even have Sunday hours. I know my children's pediatrician, they have Saturday and Sunday hours. And sometimes they'll have late night hours, open until 9 o'clock in the evening. So these are all the things that you should really think about considering before you choose somebody. Sometimes it's good to just go in the waiting area and sit there and see, the interaction of the front desk and how the staff interact with each other and what's going on with the other patients, the clientele in the room, to see if that's somewhere that you feel, you could thrive and your child could survive. All these factors are contingent on your insurance. So when you're choosing someone, it's also good to contact your insurance provider. And their number can be found on the back of your insurance card. You can call the customer service desk and they will tell you what doctors are covered under your insurance. And that's a good way to start your list. You could also ask your insurance providers if your child needs to be referred to a specialist. Does your pediatrician need to refer you, or can you make a referral yourself? So sometimes, say if your child needed to see an eye doctor, you might have to go to the pediatrician first for them to make a referral for you. Some insurance plans allow you to make that appointment yourself. So these are some of the things that, you should definitely consider. Other things you need to think about is which hospitals are your doctors affiliated with? And the hospitals that they're affiliated with, are you comfortable with those hospitals? We all know certain establishments have really good reputations and others might have bad reputations. So you need to make sure that if you got ill and you were hospitalized or you needed surgery, that you are in a comfortable hospital, somewhere that you feel, you or your child would be treated best. And again, I just spoke a little bit about, observing in the waiting room. You can tell a lot about a culture of an organization or an office by the staff that are in there. Okay. Are they maintaining confidentiality? Can you hear them on the phone talking to other patients? Can you hear them talking about other patients? All of these things that you need to, take into consideration seriously. Some pediatricians' office also offer other services. So they might have a new mothers group, okay? Or they might have first aid classes or classes on how you can resuscitate your baby, those types of things. So these are things that you can ask ahead of time. We talked about the insurance already, and I did also give you some pointers on how to locate various practices. Once you've established who your provider is going to be, before you go to the doctor's office, it's a good idea for you to make a note, have everything written down, because doctors are limited to specific time period where they can see you. It's sometimes about 15 minutes per visit. So it's good if you write down, say, the onset of whatever you're taking your child or yourself for. So if you're going for a sore throat, when did it start? Have you had a fever? Why are you worried about it? You know, all these things, you need to write them down, because what happens as human beings is when we're in front of the providers, we forget what we really need to tell them. So I'd always say, write everything down beforehand. Your doctor should be able to sit down and talk to you the way I'm talking to you now, okay? Looking at you, should be observing you. You can tell a lot by just observing somebody. You can see how they're breathing. You can assess their color. All of these things are part of, you know, their assessment of you. So if you go into an office and a doctor hasn't looked at you, hasn't greeted you, has their head down on a computer, and is ready to write your prescription immediately, that should be an indicator that that's not necessarily a good place for you to be going to. As parents with our children, you should always, always, always trust your gut feeling. So if you take your child to your pediatrician and you're explaining a symptom that your child's having, and your doctor is telling you that the child's okay, there's nothing wrong, but you know there is something wrong and you know what you've been seeing, okay, please don't leave it just there. You can have a second opinion. Most insurance companies allow you to do that, okay? But please always, always trust your instincts, especially when it comes to your child. It's very important. All right, so if you go to your pediatrician, you've been there 2 and 3 times, you're not happy, you could go to a urgent care walk-in center, or you can call your insurance company and say, what other providers can I see? You know, that can see me and give me a second opinion. I'm really worried. I think I'd like to, if Gloria's here, are you? I'm happy for you to unmute everybody, and then if you have any questions, you can all feel free to ask me whatever you would like to ask me.
Perfect. Thank you so much, Shalene, for all that information. So parents, at this point, it's a great opportunity for you to ask an expert if you have any questions, or what are some of the other things you can look for when it comes down to a medical professional. Now, Shalene comes with a lot of experience, especially also as a doula, and working with families within our community. So just take a couple of minutes, because I know I like to keep these meetings nice and short and tight. But just take a minute, if you have an expert in front of you, ask a question or two, something that might be something concerning, or if you just want to just see what else you can learn from her. Thank you.
So thank you for that, Gloria. So I'd just like to let you all know, obviously I have a British accent. So I am from the UK. I have been here for a number of years. I have a background in nursing in the UK. And I've worked in many capacities here, teaching. Most of my career has been around women's healthcare and children. As Gloria said, I also work as a birth doula and a postpartum doula and a lactation counselor. So feel free to ask me any questions or anything that I might have missed earlier during the presentation. Can you unmute for me, please, Gloria? Hello?
Althea, were you trying to ask a question?
Yes.
No,
I think they're muted. Is there anybody that would like to ask me anything? Hi, Althea.
If anybody wants to write a question in the chat, please feel free. I'm here to read the chat as well.
And I can help you on any other things that are related to health. It doesn't have to just be about, you know, your pediatrician. it can be any questions that you might have about yourself. Oh, the other thing that the health center actually offers, which I think is really fabulous, is anybody that's registered here can sign up for our pantry. And we have a free food pantry for everybody that's registered here, including staff. So that's one of the perks of working here. And also every year we have a toy drive and we give away toys and goodies to people that are registered here with children in the pediatric department. We also have dental health services too now. So you know your child should think about having their first dental checkup around the age of 1 year old. And that's something that we are happy to schedule for you. We also have speech pathology here. So if your child's having any speech problems, we have a speech pathologist that's on site here. Does anybody have any questions?
Okay, I guess if nobody has any questions, I'm not gonna hold you anymore. But thank you so much for sharing all. My child seems to be having gum irritation. Oh, Gianni's said her son is having gum irritation.
How old is your son?
My daughter is 1. She recently went to the dental
Mhm.
with the in Yonkers. But since the dental appointment, her gums just seem irritated and she has been like sticking out her tongue. Like, what would be the solution for gum irritation?
So is she teething? Have you seen teeth that are erupting?
Her molars are coming in, and I think her top teeth, row of teeth are filling in.
Okay, so that's quite a common sign, exactly what you've explained. When teeth are erupting, that means they're breaking through the gums. You often see your child salivating a lot, so that's excess saliva in their mouth. A couple of things you can do. There are some over-the-counter medications and gels that you can rub over the teeth. Also, a teething ring that you can get. You can put that in the freezer. And they can use that, and that will help soothe the gums. Quite often, they just want to bite on something hard, and that also helps with the teeth coming through the gums, okay? The only time you should really be concerned if you see anything like thrush in their mouth, oral thrush, so that's like a white covering that if you rubbed your finger over it, you wouldn't be able to remove. That's a type of fungal infection. If you notice something like that, then you would definitely need to make an appointment to see your pediatrician or your dentist, and they would provide you with the appropriate medication to get rid of that. Okay?
Okay. Say she doesn't use a teether. I've tried the teething ring. She just holds it. What
Okay.
would you recommend?
There's a couple of things that you can do. I mean, sometimes you can allow them just to bite on your finger, because you don't want to give them anything that could be a potential choking hazard. Okay. So if you're able to maybe put your finger in their mouth and she can chew on that or bite down on that. You can also get some teething biscuits or cookies that they can have, and they're just very hard and they can bite down on those also. But you just need to be careful about what you're putting in the mouth because, as I said, the main thing that we're concerned about at that age is choking.
Okay. Thank you again.
You're welcome. If any of you, if you're shy to speak over the Zoom, I did leave my phone number in the group chat. So you can also feel free to text me any messages or any questions that you might have, and I'll be happy to help you to resolve some of those issues.
Perfect. Shalene, thank you so much for your time today. especially since it's late Thursday evening. Well, I'll also share out via email with the parents the recording of this video as well as your contact information. And they know now that you're a resource in the community in case they have any concerns around their medical needs in any way. Appreciate you. Thank you so much.
Well, again, thank you for having me.
Good night, everybody.